Hi everyone, Roger O'Toole here from the Melbourne Headache Centre. I just wanted to talk to you today a little bit about diagnosis of headaches and different headache disorders. Often we get people coming in with a bit of confusion. Sometimes they've been diagnosed with one thing with one doctor and then diagnosed with something completely different at another doctor. The reason for this is that the diagnostic criteria for headaches and migraines are based on symptoms. And depending on what symptoms you've had leading up to seeing your doctor can vastly alter what you're diagnosed with. But also there's some underlying assumptions about what's causing those symptoms. A really good example is something like cervicogenic headache. Now, cervicogenic headache, we're classically looking at something where people have a painful and stiff neck, and often the headache is a fairly secondary sort of a feature. But when we look at two particular conditions like whiplash associated disorder and also persistent post-concussion syndrome, both of these, while in the acute phase, may have obvious neck signs, stiffness and pain. In the later stages, typically they don't, but they're presenting with these headaches that have very strong cervical or neck-based origins, but the headaches look like migraines. So they're foggy, they've got nausea, they have sensitivity to light. So all of these sort of classic migraine features from something that's very clearly come from a neck injury. So what are the clues you can look for that might tell you whether or not your neck is actually contributing to your symptoms? One of the strongest clues we see is a previous history of treatment. So if you've had your neck treated and it's either aggravated you or provided some short-term relief, then they're probably two of the strongest signs that your neck is absolutely involved, and we just need to use the right techniques to help control it and help desensitize it. Another very common symptom that we see with about 30 to 40% of people is just some tightness up under the base of the skull. So they often won't complain of neck pain as such, but there's just a build-up of pressure under the base of the skull. And that relates directly to a small muscle that sits under there. It is a very potent little muscle. It's actually the most sensitive muscle in the body, and it has direct links to our balance, to areas that control blood pressure and nausea, and also directly inputting into headache centers. Regardless of what headache type you have, whether it's migraine, tension headache, daily persistent headache, non-headache types such as nausea and vomiting syndromes, vestibular migraine, your neck can be a significant contribution. Now, this is something that we can see in the initial assessment. So it's not a matter of treating you for months and hoping that something gets better. We can see within the initial assessment whether or not there are things happening in your neck that could be causing your symptoms, and then we expect to see those things change within 2 weeks. So this is not a long-term process. For the people we help quickly, okay? So don't delay, all right? Give us a call. We'd love to see you. We'd love to help you, and hopefully see you soon.